Esta conferencia comenzará a grabarse.
Hello, good morning. I'm Horst Donnelly.
Good morning, Dr. Horst. Nice to see you here. Thank you for coming.
Pleasure.
I'm going to share my screen. Later, I will give you the capacity to present. I suppose that you have a presentation?
No, I don't have a presentation. I was told no presentation, just answer questions and talk about some interesting topics.
Okay, I will now share how we usually work. Let me, yeah, now. Here. Good morning, everyone. Just a moment. It's not happening now. Okay. So, welcome, good morning. For those of you that are new, we usually divide our sessions.
Morning.
Good morning. On 4 blocks. Okay, the first one is a brief presentation about some concrete projects developed by one of our usual members. Okay, today it will be by Anais Lecoberg about what has been done in the Council of European Bioregions and what are they going to do. That's 5 minutes, and the next block is about the conceptual framework about today's topic, that is the role of the life science ecosystem in the fight against coronavirus. So that will be your time, Dr. Horst, is to put on the table the main ideas about the topic for today. Okay, and based on your speech and also on the experience of a lot of people that probably will join today our session. Okay, we will share later needs and potential solutions on this topic. Okay, the proposal is for everyone to have the opportunity to speak if they want. Okay, so we ask for very brief speeches, not in the first and second block, okay, but for needs and potential solution, maximum 3 minutes time, okay, in order to allow everybody to participate. Okay, that's the idea, and we try to very strict with the time, so we will start immediately. Anais, welcome.
Hi, good morning.
I'm
And
giving
hello,
you
Horst.
yeah.
Hello.
Okay. Yeah.
You have now the presentation rights.
Yeah. Okay, so I will be very quick because I think the most interesting here today is obviously Horst giving his position, but also because luckily there are a few members of CBER that are also in the room, so I'm sure they can be more participative in the needs and solutions. So I just wanted to present a few things this morning. Let me see if this works. Okay. I just, so I announced a few days ago already, we are doing a survey within the CBER members to understand better their reaction to the crisis, and especially in terms of the of the value chain disruptions and so on, and also to ask them concrete examples of what they've been doing. So I've, as for now, on the answers, I probably can give a better overview in the next week because the survey takes time and the members asked me for a little bit more time. But in general, what I've seen and what we've seen is that a lot of the members are doing, let's say, matchmaking, especially on online platform locally to go over the fact that people cannot meet in person. Then also what we've seen a lot that a lot of clusters are doing right now is the mapping of the needs. So concretely map the issues and the potential solutions. And as CIBER, we've participated in the last weeks in big events such as the hackathon that happened 2 weeks ago, already I think 2 weeks ago, that joined about 20,000 people online. So it was a very important event with a lot of different levels, let's say, of solutions, but there are now I think approximately 120 solutions that are moving forward. And particularly what they are doing is organize a matchathon, so to go forward from just a basic hackathon to ensure that the 120 solutions have somehow good contact with investment firms or private larger industry. And in there, the role of cluster managers, we are seeing how to support, but basically on my side, for example, is to support 2 or 3 companies or IDs that were selected to ensure that we understand their needs to find the right people to go to for them to continue with their work. Another big event that was maybe not as much publicized in the life science community was the EIC matchmaking with public providers. So to continue with the public procurement of innovation, it is very important because very concrete, again, hospitals that we reached out to all over Europe made clear their needs. And there was, let's say, a e-pitching session going on during I think it was the 30th of April. And so to better matchmake again the needs and the possibility. And the last one that just happened this week, and I hope maybe in the next few weeks we could have some feedback on that, is a virtual partnering event that happened during this week that Lyon Biopol came to explain last week, I think. And so now it happened in the last 3 days, and we will have the concrete results of that. And also because this is a model that, at least in the life science sector, we are looking at very much because of the fact that we will not be able to travel so much. So it will be a lot more virtual partnering in the future. And we also have as cluster to help companies to start dealing with that. And for us, so those are the key questions. As an example, like I said, we are doing this survey to our members to understand better where the needs are. And also in the big project that we're involved in, there is now an open call that will start in the next few days for companies that have nano-enabled technology solutions and that can be embedded within this huge project that is called Open Innovation Testbed. So we are doing small steps, let's say, as cluster and CIBER, but they are there. And so the most important for me today is to introduce Horst Omday, the director of BioM, and I think we discussed with him and also with Stephanie Venelt the best way to showcase what they are doing. And so those are the 3 main questions that I am sure Horst will be happy to answer today. So to understand better, let's say, BioM answering the context of the COVID crisis. And also, well, you can see the 3 questions, and I think the best for me now is to pass on the floor to Horst. So welcome and thank you for joining this session.
Hello, good morning, everybody. Yeah, my name is Horst Omday. Antonio, I admire your haircut. Look at me. I'm looking like Jeff Bridges in one of his worst road movies. I'm trying to get the haircut, but it still will take 3 weeks or so because women are preferred in this case, which is okay for me. Next week, I would run around with a ponytail. Okay, good. Horst Domdey, managing the Munich biotech cluster since 23 years. And also overseeing the Bavarian Biotechnology Network, which connects places in northern Bavaria with the Munich cluster, which you can easily say is the major hotspot here in Bavaria and perhaps also in Germany. Now, what did we do? It was on the 17th of March when the first announcements were made that things are getting worse than expected before, that we started with different action with BioM. It is the hour of truth. It's a possibility for the biotech industry to get something done. Looking at Germany and what politicians made, I think they made many things very well. They acted in the right way, but perhaps they did not do everything. What I was missing until very recently, that politicians would have stood up and said, well, it's not only the academic scientists who can get involved in solving the problems we are facing, but it's mainly the biotech and pharma industry, which is here now in the right situation to produce better diagnostics, to start making vaccines, and also to produce new therapeutic concepts, drugs, etc. But although we didn't hear any call like this from our German politicians, we started to do that ourselves. So we activated our Munich and also the Bavarian biotech industry and asked them, how can we contribute our knowledge, our intellect to solve the crisis, which is getting stronger and stronger. And we were very, well, we did two things. First of all, we started a cooperation platform where companies and also academic institutions can offer their possibilities, can tell the community that they are open for cooperations. They can offer their specific technologies that might be needed. And then we also asked around, do you have any specific ideas for new diagnostics, therapies, vaccines that we can collect? And if we have a decent amount of these ideas, then we would like to force the political decision makers to provide money because the typical thing is in the biotech industry, these companies have their budgets for the year 2020. And of course, they have not thought before that they would do something different than their usual job. So they need some funding, and I think that's very important. This was true, let's say, for the German government, but it was also true for the European Union until very recently. Well, there were some activities there, and now we have this big activity with this 7.4 billion specific coronavirus pandemic fight fund, but nobody knows how to handle with this. Now, immediately in the first days, we got wonderful offers for corporations, and we got wonderful, really very creative ideas, for example, to improve in the diagnostic tools. Immediately, we identified a very interesting tool which makes the current analysis, the current tests much faster, which usually take 2 to 3 hours, the RT-PCR test, which is usually used, where you get your results usually on the next day or 2 days later or 3 days later. Now, here we have a company which is producing a very rapid test, where the results can be seen within 15 minutes, which is very interesting. So people know if they are infected or if they just have caught a normal flu or something else. So this is the diagnostic fields, and there are also special tools which are being developed, which make it possible, let's say, to have these tests also in the area, so also on the countryside. These are or also at the borders, for example, where these tests then can be performed very fast. And I think these systems will be ready in the next few weeks. And also in the field of vaccines, we received some wonderful ideas. Also, our platform somehow helped to bring partners together, and that is also true for the therapeutic area. I do not want to go into the details. So that's one thing that we really did, and that was very successful. And based on all the information we received from the members of our Munich and Bavarian biotech cluster, we prepared a long list of possible activities, and we submitted that to the Bavarian government, and we are just hoping that there might be some financial support to get these projects going. Now, this is one aspect. So the interesting part is that how should I say? There's a very strong connections between the companies, something that we haven't experienced before. But I think many members of the community realized that they now have the chance of their life to do something to fight the pandemic, and that they have the tools to do something. Well, of course, there are also a number of suggestions. People want to reinvent the PCR technology and things like that. And one has to be careful about that as well. Now, the other part is, and then I'm coming to the second question. Besides of having made these calls, we're also in close contact with our companies, and I think there it's very important that you have these personal contact. Of course, you cannot visit those companies because what is called, well, this is the wrong word, social distancing. I think we do not want to have any social distancing. We have physical distancing. Somebody picked the wrong word here about that. So we have this physical distancing, but we can have phone calls, and we can have video conferences. And then talking to the companies, well, we observed that there are more or less two different groups of companies. Those who have now the chance, especially those who have been financed by venture capital. Of course, they are not allowed to really cooperate in this crisis because the money has been given to them to work on, let's say, on diseases, on cancer, on lung diseases, on cardiovascular diseases, whatever. But they are trying to do their best. And then there are these other companies who are mainly providers for research tools, and they are really having a very hard time. I talked with some of the managing directors of these companies. They have losses of, let's say, more than 50%, some up to 90%. So they are in big danger indeed. Of course, in Germany, we have this wonderful tool of short-time work, but on the other hand, the employees then only get 60% of their salary, better than nothing, but you cannot keep that through for the whole time. And with 60% of your salary, it's still difficult, of course, to pay your rent and have your normal life. Yeah, okay. So there are big difficulties, and we have also very nice programs here from the German government, from the Bavarian government, which says, well, you can get loans, and these loans are guaranteed by the state banks or the federal banks. It turned out that this is, let's say, a theory, because although it's guaranteed, very often the banks, which have been, let's say, the partners of the companies for many years, now all of a sudden ask for personal guarantees. So many managing directors or owners of the companies, they have to guarantee the loans with their private property, which makes it a little bit difficult because they might lose their apartment or something like this. So these are difficult times. There we have a huge gap between what the politicians wanted and how the reality takes place. So the banks are not very willing to give these loans. Other problems that occur with these companies are that since we have this lockdown, then children cannot go to school, they cannot go to preschool, to kindergarten, and well, you can do home office work, but that's of course very difficult, and especially if you want to prepare a test and when you want to send out some material, you cannot do that from the desk at home. You have to go into office, and then you have the children who takes care of the children. So that's a big difficulty, and usually these companies are not considered, as we say in German, system relevant. Yeah, so they are struggling a lot. Now, it will be a big question how soon the recovery will take place. It will strongly depend on the fact when, let's say, also the research institutes will open their activities again. Many university labs are closed, so no experiments are done, so no orders are done. And if no orders are done, then those companies who really lived from these orders are in big danger. And if these institutes do not open their workplaces very soon, then many companies, they will run into insolvencies, and that will be a big problem. Another interesting group that we are usually taking care of are the, let's say, the scientists who want to start companies. So these startup teams who have not yet founded the company, who are looking for investors. This is also, let's say, a huge difficulty that we have to face. Having talked to several venture capitalists, they say, well, we do not really want to invest into these new things. We have never invested in vaccine development and in infectious diseases, so why should we do now? And we have also promised our investors that we only invest, for example, in drugs to treat cancer or cardiovascular diseases or whatever. So it shows that here in Germany, let's say the venture capital is very much restricted. And what I heard from the companies, they are now going to the US market because there's a much stronger openness to invest, let's say, in these kind of new activities, especially if it's completely innovative models. It's easier to get money from the United States than to get it in Europe. Unfortunately, that is the case. But on the other hand, I understand the managers of the venture capital funds who have also their regulations, who have received from their limited liability partners that it's no, from their let's say from their investors, big investors, the money only for specific indications. So this shows that, and also it has become, of course, very difficult to have meetings with possible investors. We are trying to resolve this problem to have, let's say, also virtual presentations where we present the teams who are looking for a seed investment to the investors group, and we will see how that works out, if it is as successful or not. But also many of the business angels are not very likely to spend money in these difficult days. So let me summarize that. I think on the one hand, the biotech industry is hit as any other industry by this coronavirus crisis, but there are some who really can do exciting things. There are companies which can show that this specific industry, the biotech industry, is extremely important. We have seen in the past years that the interest in biotech has been drastically reduced. It has almost diminished. But now we can expect a kind of renaissance because also the society will realize how important an industry is which works for our healthcare. Let me come to the last point. I appreciate all these, and I think that's wonderful how that is going on, that the different clusters in Europe really work together, that we can get in touch perhaps even faster and easier than in the past, because we're all getting used to video conferences and webinars with the places, with the other clusters all over Europe. And I think a very good basis for that is that we have built up in the European biotech industry, this wonderful network which connects the different places, which brings the partners together and brings the capabilities together. So I think Europe has a very good chance altogether that we will develop better, or we will develop vaccines. We might be able to develop vaccines very fast, and especially with drugs, I'm very confident that we will have there are trials, ongoing trials, phase 2 trials with some drugs which have been used in other indications, which are now tested in SARS-2 patients. I think we have a very good chance in this global race, and I'm confident there will also some very good solutions coming from Europe, from this European biotech industry. Let me stop here and wait for your questions.
Thank you, Dr. Horst. It has been a very, very complete review. Now it's time to for the rest of the attendants to share questions, needs, and potential solutions. I see that Andre from the SME Envoy Network is sharing some comment in the chat. Andre, would you comment?
Good morning, everybody. Thank you, Antonio. I was just reacting to the problems in Europe to get venture capital, which is basically a taxation problem, we all know. But we are trying to overcome that a little bit. We have created a fund of funds which should increase the availability of venture capital, but it's not going to be, or it's perhaps never going to be on the American level, simply because of the taxation issue that, well, I don't think I will see this in my active time, and our children perhaps neither, that we will have a common taxation policy that would allow VCs to offset losses in, say, Portugal with gains in, to stick with Horst's example, in Bavaria. But I just wanted to point out that there are some things done, but it's not an awful lot due to the situation.
Okay, if I may comment on that as well, which comes into my mind, we have also approached some family offices. So these are those people who are very rich, yeah, who have billions on their bank accounts or in form of shares or so. And we do not even ask them that they should invest, but we ask them for some kind of contribution. We ask them that they should think of some charity actions, but they say, no, we've already lost with this crash that we had in the past weeks. So in so many hundreds of millions, we cannot give you 1 or 2 millions because we are getting poor these days. Yeah. So I'm also disappointed that those who have the capital do not want really to contribute. And then we see, for example, actions from the German government that they want to bring a very specific tax for the billionaires in Germany. And after this reaction, I can completely understand that. I'm not a billionaire, so I'm not affected by that.
Thank you. Okay, more contributions. It would be good if we could share. Jaime, I will let the experts speak if you don't mind, okay? So, needs. There is a lot of experts here from your area.
Yeah, if I may, just a need that we discussed with Stephanie, actually also working at BioM, maybe she can intervene here. One of the key needs is about the let's say ongoing project, especially for example the cluster excellence program and so on, that foresee a lot of on-site meeting for the companies and missions and so on. And one of the need, maybe like I said, Stephanie, if you want to complement on that, but one of the need is how do we handle those programs, because there are online solutions, but how can we? So it's a very practical question. Let's say for these programs, that how can we shift to this new kind of models that we will have to use at least for some time now, of online meeting and not so much of on-site meeting. So how we can transform those missions.
Thank you. Nice.
Stephanie, do you want to answer or should I?
Well, I more or less posed the question. So the question is more posed to the European Commission, I suppose. But I think that there are so many very good tools developed by clusters all around or all across Europe, tools where companies can meet in modern sort of ways, where they can pitch to investors, where they can have little chat rooms to talk to potential customers or potential collaborators. And those tools usually receive funding from the European Commission in a way that people meet in person, but not sort of virtually. And my wish would be that for those projects that are now frozen by the European Commission because it requires the personal meeting of the people, here we really damage the SMEs, because they cannot continue to participate in those programs. They cannot, with the help of the clusters, reach out to companies and contacts in other regions that easily anymore. And so I would really like to see that there's some flexibility in how we can use the funds from the European Commission and continue our projects, but on a virtual basis.
Stephanie, I would like to, yeah. Okay, go ahead.
No, go on. Sorry.
Yeah, well, I would like to confirm that, but I see this attitude also at, let's say, also some here authorities in Germany and Bavaria. It's extremely difficult to switch the mindset that things which have been done, let's say, in physical presence can now also be done, let's say, through these virtual meetings. I think it's a wonderful chance also to accept digitalization and what is being offered at the moment. I see that again. I want to confirm also with some authorities here in Bavaria and in Germany. And I think the European Union and the European Commission could play a very important role to say, yes, we accept those as a possibility to meet. There are specific things where you cannot, we had on our agenda, for example, our boot camp. You cannot do that by a virtual meeting, but meeting of, let's say that the companies talk to each other, that they talk about how to cooperate and things like that, and that members of one cluster meet another cluster. We can see that in this conference here, that it is possible. And I would also say, well, we need here a better solution. And I hope that the European Union, the Commission, and let's all say all the administration of Brussels will push that. Not at the moment they are restricting that, but they should go here as a very good example. Then it's also better accepted from the local, regional, and national authorities.
Thank you. Andre, you wanted to comment on that?
Yes, two points on this. Number one, this is always the worst excuse that one can have, and I'm talking under the control of any other Commission colleagues who are in this chat. But in projects where the cost for traveling to meetings, traveling to gatherings, be it because Horst, you mentioned boot camp, be it something like that, or be it something that technically speaking could be held online, are foreseen as reimbursables. You cannot reimburse something else than travel. This is a budget problem that I'm happy to take up, but this is not something that you can switch from one day to another. The other problem, in projects where this is not specified, it should not be a problem to use the money instead for online meetings. However, in most of these projects, buying infrastructure is not allowed. Again, this why not? Because we're not there to finance somebody's laptop somewhere. So this would have to be seen for a number of cases to see what we have to change. But I'm happy to take this up because we are running a number of these networks, and we will eventually run into the same problems. However, I'd like to end on a positive note. Well, I'm not going to. Yeah, I do end on a positive note. This European Cluster Alliance is actually also partly financed from the EU, and we are just meeting online, so it's not that bad.
Yeah, but
Okay.
it's true that there are some tools that are, because to use these kind of tools is not so expensive, okay? But there are other tools more complex in terms of combining matchmaking with video conferences or with online translation. Sometimes it's necessary if you go to the field, okay? And it will be really important to facilitate that kind of tools for all the class, not only the cluster, all the collaborative environments in Europe. I think it's a very, very good point. Dolores, you wanted to comment?
Well, sorry, because I arrived late, so maybe I missed, but I have two questions. The one is, there is already any strategy to accelerate or facilitate then the scale up of the solutions achieved or reached for this biotech industry? Because it's really difficult to find already a solution, but then you need to expand or scale up. This one. And the other is, there is any consensus to decide which of the biotech projects are really mission critical and can fulfill all the value chain without any disruptions due to raw materials, due to logistics, due to the need of the number of patients need to complete the studies. The whole process to validate a biotech solution, it's very complex. So I don't know if there is at European level any consensus to identify which one are really mission critical.
Well, not to my knowledge. So some of our companies, for example, are very important, but they are not considered as to be really relevant. So in Germany, for example, we have. Excuse me?
Yes, we are losing your. Perhaps if you put off your video, we could hear you better. Could we? Could you try that?
Like this?
Yeah, try now,
Works.
please.
Does it work better? Okay.
Yeah,
good.
I think so.
Yeah, well, I think it's very difficult to discriminate also on the regional level which of the companies are really relevant and which are not relevant, which are getting big support because they are needed, for example, for taking care of patients and contributing very strongly to for the hospitals, and which are not. And so there are some barriers which make it very difficult to get from one category to the other category. Very difficult. Then you mentioned also the problem of scale up. I know this is very important. Recently, I heard I talked to a company which is developing a vaccine. They said, well, one of the major problems will be we do not have enough vials, and we do not have the possibility for filling up the hopefully successful vaccines. Because we need not only millions, but we need billions of vials, and this glass is not available. So there are many things which we have not considered before, and we have to take them into account very, very early. Like the question with the masks, where nobody really had enough masks, and we had to get them from anywhere. So here in our neighborhood, everybody is producing his or her own mask, and we should have thought of those things beforehand. I always mentioned that, let's say, the defense budget for Germany is 45 billion per year. It's a defense budget for preventing wars or what interfering in wars in other parts of the world. There's more or less no budget to fight in the war against nature and against viruses, bacteria, etc. I think here we also need a completely new understanding that we have to do something. Although a person like Bill Gates told us already a couple of years ago that we have to do something, nobody listened to him because he said, well, this is a typical thing for a multi-billionaire that he's saying these things, and now we see that he was absolutely right. I think that's very important, that we have to be better prepared in the future, and I hope this new fund, which has been created in the past days by Ursula von der Leyen, will really help, not only for the time being, but also for the future.
Thank you. So Andre is asking for concrete examples of where networks could not continue working. That would be good. Yeah, we could explore this kind of examples. Okay.
Yeah, I need a few concrete examples, and I'm happy to take this up. And when I say concrete example, it's not about naming and shaming. It's just to see where really the problems are, not to sort of fire into the into the public indiscriminately or into my budget colleagues indiscriminately. Just to see where really the problem is. Happy to take this up.
Yeah, let me perhaps add another example. We are also a little bit funded by the European Institute of Technology Health. Here, for example, we have done very successful boot camps in the past years. Now, this year, the boot camp could not take place because it's not possible, let's say, to fly it was planned for May to go to Oxford and have the first part of the boot camp there, and that the Oxford people coming in June to our place. So since we had to cancel this project, and one person, let's say one of my best co-workers in our cluster management organization, I had to tell her that she has to leave because I have no money anymore, because there was no possibility to say, well, can we not use this money for another purpose? I think that would be something which would help the companies and also the cluster management organizations a lot, because we have our current budgets, and now we cannot do those things that we had prepared to do. So we have to give probably away some of our money, which means that we have to lay off people. Those people which have been working for years have done a very good job, and we are losing a lot of competencies, and this would be a real disaster. And we are expecting to have such a disaster with this. I appreciate, let's say, our Bavarian government, who's very open to that. They say, well, if you think that is very important to do, don't care what you wrote into your proposal for the to-dos in 2020. You do what you think is right to do in this crisis. And I think this openness would be great if we could get that from the EC as well. Of course, with all the controlling that is necessary.
Perfect. There are any other examples between those that are here today? Will somebody?
Hello, can you hear me?
Yes, we can hear you. Go on.
So, hello, this is Rosa Pucio from Atlampol Biotherapies. Another example that I can give you is a project that we have in Nantes, and BioM is also one of our partners. It's a cluster of excellence project with a cluster exchange scheme. This scheme was written to help the SMEs to do something like a little Erasmus experience, starting at 3 days of exchange up to 30 days. And we have a special budget to fund these exchanges between companies. Of course, it's impossible right now because we cannot travel, and probably we won't be able to travel for a long time. And our idea was to organize first the matchmaking and then find those matches between the companies. So one company from for example, France, could go to another European company for from 3 to up to 30 days. And we have a specific budget to fund all these activities, including some training, including matchmaking, and including the exchange. But obviously right now we are halted because we cannot advance. So this is typically a project in which we could use some flexibility, maybe not for the whole budget, but for at least a part of it, so we could facilitate via trainings or via funding a part of the work that companies do for the online matchmaking and online partnering events through this project. It was Cluster Exchange Scheme. It's a COSME project.
Thank you. Thank you. Okay. More needs. I would like to invite you to think about what will be really useful, helpful. Sorry, in the fight against the COVID. Okay, that is clear that we have a problem with the exchange schemes. So what else? Or solutions? You can also propose solutions. Remember that we are speaking about needs and solutions.
May I say something? Well, I think it's fantastic that we have now, or that Ursula von der Leyen has collected this huge sum of money. Now, all the regional authorities or governments, the federal governments say, why should we do something extra? Because there are these 7.4 billions sitting in Brussels, or not yet sitting there, but money that is committed. Now, I think it's important either to let all those who have these innovative ideas, who can really fight against the pandemic, how this money can be used, how it can be approached, and even if one says, if we get the information, well, it will still take another half year or something that we have this process going, then this has to be communicated as well, because now we see the big danger that the regional governments and in Germany, the federal government will say, well, we have done our contribution, we have not to do anything by ourselves. And on the other hand, we do not know anything about what's happening in Brussels, how the companies can get access to this money. Or, well, I think there have to be some clear words, because otherwise we are in a vacuum and nothing is done. In contrast, let's say, unfortunately, I have always to bring the example of the United States. In the United States, all the authorities are very, very open. There's a huge sum of money. There is money from the venture capital. There's non-dilutive funding, etc. And I think we in Europe, we really have to do something for Europe, because if there's a new drug developed, if there's a new vaccine developed, it will be distributed, first of all, in the United States, and only then maybe it's coming to Europe. So we have to be independent here of the activities in the United States, and of course also of the activities in China. There we also cannot be sure. And that's why it's important to get things going.
Okay. Very important point. Aurora, would you comment?
Thank you, Antonio. Yes, I'm always thinking about the large effects of what we do, and the points that have been pointed out in this meeting, fortunately, are common to every sector. For instance, I have projects on space, and I have also projects on bio connected. My company is a small SME, but we do a lot of things with other entities, and we work with very interesting entities on top of the level projects, and all of them have been stopped because COVID is priority. When I think that all the points are common to other businesses and activities. For instance, companies that only do events, they have stopped completely. Universities are having classes throughout WebEx and Zooms and whatever platform, and students have been split around the world. They came home, they went home, but classes go on. Projects have been started because of COVID with people that cannot meet together, but they do things. For instance, the thousands, I think, well, not thousands, but I believe hundreds of projects for doing the ventilators. No one was waiting for money. Let's do things because all the sectors are suffering, all, not only bio. And I do not wish to have a Europe equal to the US in terms of the favorism. In space, for instance, before COVID, NASA gave a huge amount of money to one company to develop space projects. I'm so happy that Europe cannot do that. I'm so happy that Europe has fair rules. I'm not happy that Europe has not the same amount of money, of course, but that depends on countries, because we don't have the budgets. We don't give Europe the budgets, the common budgets, to be ruled with the same kind of decision to dedicate the money to this and that, to what priority. But the fairness is so good, so good.
Thank you for your contribution. More. Who wants to participate? There are a lot of clusters from the bio. Remember that today is about the life science ecosystem and what can it do. I think it's very, very relevant. Dr. Holtz was speaking before about a new detection system that could detect in 50 minutes. But the question is, when will it be in the market, and how many detection devices could you make in 1 month? How we scale that?
Yeah. Well, let's say the system already works. There's this proof of concept now, and they have prototypes, and now this has to be turned into a big series where thousands of devices can be produced. Everybody is waiting, let's say, and the first 1,000 are already getting into production in this month, and there might be several thousands more, because here it's not then anymore the task of the biotech company which has developed this assay, but it is then the task of companies who have worked, let's say, on producing car parts for cars and things like that, and they're very happy that they got a new opportunity to also cooperate in this very specific field. Now, there are also other problems, because for these tests, which are biochemical reactions, you need very specific, let's say, products, enzymes, which do the reactions. And there is a shortage of these enzymes. And very often, well, in the past, it was no problem to get the enzyme from the competitor. But now the competitors, they keep the enzymes for themselves. So also here in this case, we have to start a completely new industry. We are helping our local companies to do that. And let's say these are very, very new challenges. But I'm very confident that, let's say, middle or end of June, they can start with the production of 100,000 of these engines. So one test here only costs 10 euros, for example, just to give you an example. And the device is also in the range of 10,000 euros or something like this. This device is very small. It weighs only 3 kilograms. It can be battery driven. So there are very good opportunities. And then there are also different tests being developed. So for example, it's kind of a home test. It's more like a pregnancy test. Yeah, it looks like a pregnancy. Well, it doesn't show pregnancy. It shows only if you are infected or not. But that's also very interesting because it diminishes another big danger. The biggest danger in taking these tests are for those people who take the biologic sample from your throat or from your nose, because they are always endangered through the aerosols that are sitting there. Now, people can do that at home. If they are infected, then they are already infected, no third person has to be, let's say, in action and is in danger in this way. And also these tests are on a very good way. So there are different things. People are getting so creative. It's fantastic. So this one opportunity, one possibility to have these diagnostic devices. And what is also was very good to hear that vaccines, it will take long, of course, because these vaccines cannot be used in a compassionate use way, in contrast to drugs. If you have a drug that looks very interesting, and although it has not seen more than 100 or 200 or 300 patients, like the drug from Gilead, Remdesivir, with vaccines, it's not possible. But with new therapeutic, let's say, accesses, I see also very good examples, not only here with us, but in many parts of the world. So I think we will have a good chance to drastically reduce the fatalities which we have currently in the hospitals, which will also enable us to live a more normal life, because you are not threatened by death anymore as you have been now in the past months. So there are many opportunities, and as I said, it's this very specific biotech industry which has really lots of chance to save the world, or to save at least many lives.
Let me ask again, sorry, because I am really worried by the numbers. Okay, there are 446 millions of people in the European Union. Do you think that we will be able to make one test for just 10% of them during these next months? 50 million? Or do we need to make something in order to be able to do that? Can we help? Can we help in the creation of those devices? Or do you estimate that is enough with what you have?
Well, I think these devices can be made, and there will be big industry part. Well, we have to discuss that perhaps separately, but maybe if it can be supported by Europe, fantastic. One can also license out, for example, this technology to other partners so that they can be produced, let's say, in Spain, France, Italy, Norway, and wherever. That's another possibility that we might have once the system works. That's fantastic. Yeah. The good part of the system is that it's really, well, it doesn't cost a lot. It can be very effective. And that's the big opportunity that we have here at the moment. Well, we can talk about that. So that's a possibility. On the other hand,
this is an official offer. sorry, but this is an official offer because it's critical, and it's something that is happening to me a lot these days. Somebody thinks or tell me, we are able to have 10 million max from Spain, 10 million max. 10 million max, but we are 60 million. And if we need to give the population 2 masks by week, only 2 masks by week, that means 400 millions, not 10. So that's the hard reality. So this is an official offer for you.
Okay.
just to think
Okay, I'll
about
come back
how
to you.
to really make the numbers, the
Yeah.
numbers that Europe needs.
I have to go back to the company to find out exactly. Okay.
Thank you very much. Mo.
Sorry, I'm Aaron Cabrera from Functional Print Cluster. Dr. Horst, couldn't you explain a little bit more about how this test system works? In which kind of technology it works? I don't know. Is it antibody? It's a kind of PCR or something like that?
Well, of course, well, this is the test to develop, well, to see if a person is infected or not infected. So at the moment, the question is not, we do not want to let's say, to have a mass test like this, because it's not necessary. Only people who feel really bad, who think they are sick, are tested at the moment. I do not think that it makes sense that each person, because then each person would have to be tested every day. But I think one should test much faster, much better, and that's an opportunity. And especially one should test those people, and that's why this test is very, very good. For example, at the hospital, so when people are coming in, the doctors, the nurses are coming in, that they can be tested, and it only takes 15 minutes until they get the answer, and then they know, or especially perhaps not even when they come in, but when they leave. This test also is very important, for example, when people arrive from other countries at the border controls. So people are tested if they have high temperature. So they are supposed to go into quarantine if they want to enter the country, into quarantine for 2 weeks. If they get this test done, they just have to wait at the border control for another 15 minutes, or let's say with taking the sample, etc., 20 to 30 minutes, and then they can say, well, it's just a normal fever that you have, and there's no sign of any infection with SARS-CoV-2. That will be a possibility. The technology that is used, it's a very specific PCR technology where the reaction is taking place in seconds. So you do not have to heat the whole sample, but it's only, let's say, that place where the reaction is taking place in the sample, which is heated up. And that's the reason, even after 3 minutes, when you look down into the system, you can see if a person is infected or not. But to be on the safe side, one lets the reaction to continue for 15 minutes. Yeah.
It's then it's an isothermal amplification of RNA or something. Okay, yeah. Thank you.
Yeah, and then there are of course also these antibody tests which can be distributed. So here we have a small local company. They can produce, and they are already producing, 400,000 of these antibody tests. So where they take an antigen from SARS-CoV-2 and check if an antibody has been made. So that's a possibility, and this test only costs €3 or something like this. And these tests would be great to find out more about the pandemic in specific regions. And well, this is possible. So all these technologies are available, and it's not only the big companies that can do that, but also startup companies. People are working there 6 days per week, and something like there are 2 shifts of 12 to 16 hours. Yeah, so it's fantastic. That's what I meant. You see all these activities in the biotech industry for those who really can contribute. Yeah, and these tests can be available. So, but there has to be also a political will. Very often the politicians say, yes, we need more tests. Now these tests are available, and now I know from this company they're sitting on 1 million of these tests. And nobody wants to buy them because they say, well, who should do that? Of course, you need the doctors who take a droplet of blood, which is only allowed to doctors and nurses, so people cannot do that by themselves if they don't have this specific home test. But this is not taking blood samples, but this is taking just samples from throat or nose.
I think that Dolores has a very interesting proposal, because here in these sessions we are looking for cross we call them co-evolving ecosystem, and we are here with a very interesting proposal to mix or link 2 different ecosystems, in this case of the Turing's ecosystem and the biotechnology. Could Dolores speak about it?
Though it's just an idea that came up to me just few minutes ago. It's not really well proceeded, but okay, we can take advantage of the logistic networks already from the tourism industry to administrate this test to the massive population. So in this way, you tourists can gain trust from people, so probably also benefits or can recover their economics, and on counterpart they can contribute with some of these benefits to the continued developing of the test. I don't know, it's a general idea. It sure needs to be more studied or analyzed, but the main idea is like that. Try to take advantage of things of an ecosystem to come back and help the other.
Hi, can I sorry. Can I contribute, Elena here? I have a proposal. We have a network that it's very widespread and can do these tests and also have the personnel with the habilitations to do that. We have the pharmacies. The pharmacies are widespread and have a wide range that can reach to a very big number of people, and are here in Portugal are very well distributed, and they have the ability and the knowledge and the possibility to do the test because they already do other tests. So I think it's a very interesting network to explore to do these tests so that we can reach to a very big number of people and have results very quickly. So this is my suggestion.
Very good idea. Fantastic. Yeah. I think, but we have to change some rules because then also the pharmacist has to be allowed to give the result to the person who has been tested. At the moment, it's only very specific types of medical doctors who are allowed to do that. Yeah, because it's an analysis that it's a diagnostic answer that has to be given, and not everybody is allowed to do that. But maybe we have to, this is perhaps something which is not assured by the voice of a doctor or by the signature of a doctor, but I think it's an important information. I wrote that down. I think it's a very good idea.
We need to change the rules, or suggest to change the rules. Yeah, it's part of what we need to do. Okay, thank you. Well, we are out of time, okay, but the conversation is really important, really interesting. One last comment. Okay. So, if not, thank you, Dr. Horst, Anais, everybody. It has been a very, very interesting conversation today, as always. But yeah, I have really enjoyed it. Thank you, and we will continue because, as most of you know, we are going to create a specific groups or nodes to analyze every ecosystem, and you will be invited to participate on those. Also, I want to remember you that you are invited to participate in an open discussion on the ECCP Forum. I will share my screen quickly. It is in the chat, okay? That is the place to share with all the community proposals and ideas. We will create a specific topic for every session. We will put there the presentations, and I see if you send it to me, or you could yourself put it in the topic, okay? And I invite you to make continue the dialogue there, okay? Thank you, everyone, and see you tomorrow, I hope.
Thanks.
Thank you. It was a pleasure. Take care.
Thank you, Antonio.
Thank you all. Have a nice day.
It was a very interesting session. Thank you all.
Thank you very much.
Thank you very much, and thank you, Horst, for sharing with us all the amazing things that BioM is doing right now. It's inspiring.
Yeah, congratulations, by the way. Yeah, you're doing a very, very good job.
Thank you. Bye-bye.
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 Yes.